Hey future doctors, welcome to Pocket Mbbs, where medicine fits in your pockets. Now let's study today's topic. It is antihypertensive drugs. Hypertension is persistent elevation of BP more than or equal to 140 by 190 mmHg. Normal blood pressure is less than 120 to 80 mmHg. Elevated is 120 to 129 per 80 mmHg. Stage 1 is 130 to 139 per 80 to 89 mmHg. Stage 2 is more than 140 by more than 120 mmHg, and hypertensive crisis is more than 180 by more than 120 mmHg. Pathophysiology of hypertension is they increase the sympathetic activity from the brain, stimulates the alpha 2 receptor, and adrenergic nerves releases epinephrine and norepinephrine. They act on the heart, blood vessels, and kidney. In heart, they activate the beta 1 receptor, open calcium channels, increase the cardiac output and contractibility of heart, and increase systolic blood pressure. On blood vessels, they act on alpha 1 receptor, open calcium channels that leads to vasoconstriction and increase the diastolic blood pressure. On kidney, they act on beta 1 receptor, they direct renin release, activate the RAS system, and antidiuretic effect that leads to increased blood volume and decreased urine volume. Antihypertensive drugs are diuretics, RAS inhibitors, calcium channel blockers, sympathetic inhibitors, and vasodilators. Diuretics are of three types: thiazides, high ceiling, and potassium sparing diuretics. Thiazides are hydrochlorothiazidine, chlorothalidone, and indapamide. High ceiling are furosemide, and potassium sparing is spironolactone, eplerenone, and amiloride. Thiazide is not effective in severe hypertension more than 160 by 100 mmHg. High ceiling is effective in severe hypertension, and potassium sparing is drug of choice for resistant hypertension. Uses of diuretics are in hypertension, heart failure, edema, glaucoma, and cerebral edema. Adverse effects are electrolyte imbalance, hypokalemia, hypotension, metabolic alkalosis, and ototoxicity. RAS inhibitors are of three types: ACE inhibitors, angiotensin receptor blocker, and direct renin inhibitors. ACE inhibitors are captopril, enalapril, lisinopril, perindopril, ramipril. Angiotensin receptor blocker are losartan, candesartan, valsartan, telmisartan, olmesartan. Direct renin inhibitor are aliskiren. RAS inhibitors conserve potassium and cause sodium loss. Their mechanism of action is RAS inhibitors decrease angiotensin 2 that leads to vasodilation and decrease aldosterone secretions that leads to sodium and water retention decrease that leads to decreased blood volume and decreased peripheral vascular resistance that leads to decrease in blood pressure. They are used in hypertension, heart failure, and chronic kidney disease. Their adverse effect is hypotension and hyperkalemia. Calcium channel blockers are of three types: phenyl, alkylamine, benzothiazepine, and dihydropyridines. Phenyl alkylamine includes verapamil. Benzothiazepine includes diltiazem, and dihydropyridines includes nifedipine, felodipine, amlodipine, nitrendipine, and lecidipine. Their mechanism of action is calcium channel blockers block calcium from entering the muscles that leads to burst blood vessels cannot contract, they relax and become wider that leads to decrease in blood pressure. Uses of calcium channel blockers in hypertension and angina, and their adverse effects are headache, flushing, and hypotension. Vasodilators are of two types: artery dilators and combined dilators. Combined dilators include both artery and venodilators. Artery dilators are hydralazine, minoxidil, diazoxide, nicorandil. Combined dilators are nitroprusside. Mechanism of action of vasodilators are vasodilators relax the vascular smooth muscle that leads to decreased vasodilatation, decreased peripheral vascular resistance, decreased blood pressure. Uses of vasodilators in hypertension, heart failure, hypertensive emergencies. Adverse effects are reflex tachycardia, headache, flushing, dizziness, and SLE, systemic lupus erythematosus. Sympathetic inhibitors are beta adrenergic blocker, alpha beta blocker, and central sympatholytics. Beta blockers are propranolol, metoprolol, atenolol. Alpha blockers are labetalol, carvedilol. Alpha blockers are prazosin, terazosin, doxazosin, and phenethylamine. Central sympatholytics are clonidine and methyl-dopa. Alpha and beta blockers are labetalol and carvedilol. Mechanism of action of sympathetic inhibitors are they increase the sympathetic nervous system activity, decrease heart rate and cardiac output. It leads to vasodilation, that leads to decreased BP. Uses in hypertension, hypertensive emergencies, hypertension in pregnancy, and pheochromocytoma. The adverse effects are postural hypertension, bradycardia, dizziness, sedation, drowsiness, or dry mouth. Hypertension in pregnancy. Safe drugs in pregnancy are labetalol, hydralazine, and methyl-dopa. Unsafe drugs are spironolactone, atenolol, propranolol, and nitroprusside. Chronic hypertension in pregnancy, drug of choice is methyl-dopa, and labetalol is also given. Pregnancy-induced hypertension in which the placenta is more than 20 weeks of gestation. Their hypertension is also known as preeclampsia. Drug of choice is labetalol, hydralazine, and nifedipine. That's all for today's videos. Thank you. Follow for more such videos.